So, so today we are going to discuss the anatomy of ear. The first question in the anatomy of ear is the structure of the tympanic membrane. So the tympanic membrane is composed of three layers from outside to insides. The outer cuticle layer lined by the hairless keratinized stratified squamous epithelium and is continuous with the skin of the external acoustic meatus. Intermediate fibrous layer made up of superficial radiating fibers and deep circular fibers, and then we have the inner mucous layer. As it goes going inward into the middle air cavity, so it becomes mucus because the inner uh, cavity is lined by the mucous membrane. So uh, the inner mucous membrane is lined up by the simple columnar or squamous epithelium with patches of ciliated cells. So here we have the if you look at the external ear, so here we have the antihelix number one, and then we have the um, antitragus number two, and then we have the auricular tubercle, which is at number three, and this is the auricular tubercle, and we have six, which is the helix, and seven, the enterptegic notch. This it is one of the point in the surface anatomy of the parotid duct, Accustoms and duct. So head number 8 is the lobule, and number 9 is the here. Number 9 is the crust, lower crust of the antihelix. So this is uh, number 6 is the helix, and as we discussed earlier, the number 6 is the helix, number 1 is the antihelix, and this is the superior. 9 is the superior crest, and number 2 is the antitragus, and 14 is tragus. 14 is tragus, and opposite to it will be the antitragus. So 9 is the superior or lower crest of the antihelix, and so we have 11 is the mastoid process, and the 12 is the scaphoid fossa. Number 12 is the scaphoid fossa. Here we have the so 6 is the antihelix. It is continuous as like this, and head a small notch, a small tubercle, not notch, a small tubercle is called the antihelix tubercle, or it is also called auricular tubercle. So 4 is the crus of helix. This is the crus of helix. Number 9 is the inferior lower crus of the antihelix, and 10 is the lower part of the concha. 10 is the lower part of the concha. 11 is the mastoid process. 12 is the scaphoid fossa, and then we have the 16. 16 is the triangular fossa, and then we have the 18, which is the upper part of concha. 10 is the concha, 18 is the upper part of concha, 17 is the upper crust of antihelix. So the antihelix, this is the antihelix, it goes like this, one crust and lower crust. So this is the lower crust, this is the upper crust. So 9 is the lower crust of the antihelix, and 17 is the upper. And yes, this is the right external ear. So here is the right tympanic membrane as seen through oriscope or otoscope. So this is otoscopic view of the, so this is the interior, this is the posterior, so this is the right ear. Remember, this is the right ear. So number first is the cone of light reflex. So if you look in the otoscope at the tympanic membrane, so you will feel, or you will look at the shine of light, which is called cone of light or the light reflex. Then you have the pars tensa number 2, and then you will have the pars flexida at number 3. So, and then you have the 4 cauda tympani. This is small nerve of the middle ear cavity. So this is the you can see the shadow, or you can see the yes, this coda tympani. And then number 5 is the malleus. Okay, number 5 is the malleus bone, and number 6 is the umbo. Number 6 is the umbo, and number 7 is the Encke's long process. Encke's long process. So remember, the middle ear cavity has 3 bones. The 3 bones, which is the malleus, incus, and stapes. Malleus, incus, and stapes. So you can remember it by psi. Remember it by psi. What? Psi. SCI. Stapes, incus, and sorry, you can remember it by miss. Sorry. Psi is a mnemonic for something else. I will tell you later. But here we have the miss, malleus, incus, and stapes. So this is the otoscopic view. Here you can see the drawn picture, the handmade drawn. So this is the umbo. Okay, this is the handle of malleus. Here you can also see this, the handle of malleus, and where it gone? So we have number 5 is the malleus lateral process, and this is the long handle of the malleus, and this is anterior malleolar fold. This is the posterior malleolar fold. You can see here the anterior malleolar fold and the posterior malleolar fold, and then we have the pars flexata, and this is the pars tensa here. Okay, this is the cone of light. This is the pars. This whole is the pars tensa, and here we have the pars flexata, and here this is, you can see here, I will show. If you see here number 7, so number 7 is the Encke's long process. So here you can see this is the Encke's long process. Okay, so this is all about the otoscopic view of the tympanic membrane. So how is the roof of the middle ear cavity formed? This is formed by the tegmen tympani, a thin plate of bone from the petrous part of the temporal bone. So this forms the roof of the tympanic cavity or middle ear cavity. So identify internal auditory meatus. Internal auditory in skull base. They will show you the skull, and you have to identify structure passing through the internal auditory meatus. So we have the facial nerve, and then we have the vestibulocochlear nerve, and then we have the labyrinthine artery. In most cases, a branch of the anterior inferior cerebellar artery, AICA. Anterior inferior cerebellar artery. So we have the AICA. So the labyrinthine artery. So what can make the irreversible damage to the vestibulocochlear nerve? So acoustic neuroma. And why patient with acoustic neuroma hair sounds loudly on affected side? So affection of facial nerve can cause the paralysis of the stapedius. Function of stapedius is lowering the vibration of sound. So stapedius usually helps in the damping of sound. So what type of facial nerve palsy it would be? So what are the other signs? So lower motor neuron type of facial palsy. So other facial other, what are the other signs? So other signs, one can be the this loud sounds, hear the loud sounds, and the angle of unable to frown. Okay, and unable to frown, weakness of the eye closure, and the angle of the mouth dropping. What is promontory in the middle ear cavity? So around it, hollow prominence formed by the projection of the first turn of the cochlea. So cochlea, we know a turn. So the first turn in the cochlea. So this will form the promontory. Promontory, around it, hollow prominence. So on this promontory we have the tympanic plexus. So which part of the ear contains ossicles? So it the middle ear. Relation of the middle ear. So roof is formed by the tegmen tympani. Tegmen tympani separate tympanic cavity from the middle cranial fossa. The roof separates the middle ear cavity from the middle cranial fossa. The floor jugular wall. Thin bone separate tympanic cavity from the superior bulb of the internal jugular vein. Nerve. Internal jugular vein, not nerve. Okay, so floor, the jugular wall, this one. So what it does, it separates the thin bone separates tympanic cavity from the superior bulb of the internal jugular vein. Okay, and here you can see from the lateral view, we have the mastoid process. This is the internal external auditory meatus, and we have the styloid process, and this is the ramus of mandible, and this is the you can say the temporal part, squamous part of the temporal bone. And then we have the anterior wall. So you can see the anterior wall is here. So thin bone separates tympanic cavity from the internal carotid artery here, and its upper part are opening into the two canals, the auditory tube, which opens into the nasopharynx, and then we have the lateral wall of the nasopharynx, and then we have the canal for the tensor tympani. And then we have the posterior wall, mastoid wall. This is here we have the mastoid process. Here you can see, so adductus to the mastoid antrum superiorly here, and pyramid inferiorly for stapedius, this one. So this is the posterior wall, and lateral wall, lateral wall will be the wall through which you are looking into the internal middle ear cavity. So this will be the membranous wall here formed by the tympanic membrane, does not extend superiorly, and lateral wall of the epitympanic recess superiorly. So the tympanic wall forms inferiorly the lateral wall, and superiorly does not extend, and so we have the epitympanic recess. And middle wall is formed by the lateral wall of the inner ear. Here we can see this is the inner ear, which we have promontory, and the promontory, the oval window and the round window, and we have the tympanic plexus. Which cranial nerve passed during its course between tympanic membrane and the mastoid ear sinus? So it's the facial nerve. If you have infection in the middle ear cavity and spreads into the middle cranial fossa, where will be the abscess? So it will be in the temporal lobe, which is called autogenic, it's autogenic abscess. What is the route of spreading infection from the middle ear? So direct erosion from the bone, infected thrombophlebitis of the emissary veins, and vestibulocochlear aqueduct. So what is the clinical picture of meningism, photophobia, neck stiffness, and fever? Kerning sign. What other cavities can be affected apart from the tympanic cavities? So mastoid antrum and ear cells, mastoid ear cells. Anatomical level of the thyroid. Okay, so here we move to the thyroid gland. So we will make a separate video for the thyroid gland.